In all 50 states, you and your employer are required to comply with Obamacare, also known as the Affordable Care Act, or ACA. Under the law, individuals and their families may be subject to financial penalties for failure to get health insurance. The ACA guarantees access to coverage for everyone, regardless of pre-existing health conditions, but requires that you get insurance or else significant IRS tax penalties can be imposed on working individuals and their families who haven't signed up for health care coverage that meets certain minimum requirements. In 2016, these penalties can amount to 2.5% of your annual income. The typical penalty will be $695 per adult and $347.50 per child to a maximum of $2,085. In 2017, the penalties may increase further, so it makes sense to get health insurance and improve your well-being. You and your family have access to affordable benefit plans that will help meet your healthcare and financial needs during the upcoming year and fulfill the requirements of the law, and your employer will pay a portion of the plan premiums. You can select from 3 health plan options: Minimum Essential Coverage, Minimum Essential Coverage Heavy, and a Minimum Value Plan. The Minimum Essential Coverage Plan, or MEC, is your least expensive option and provides 71 preventative services for you and your family. These benefits are paid at 100% with no deductibles and no copays. This plan is focused on preventative services only, so your employer is making available a limited benefit health plan that will provide basic payment for doctor's visits, X-rays and lab services, prescription drugs, and hospital benefits. The Minimum Essential Coverage Heavy Plan focuses on outpatient care. This is the most popular plan as these are the benefits that are used the most. The plan has no deductible and co-insurance is 100%. Your coverage provides benefits for doctor's visits, X-rays and tests, emergency room, urgent care, and both generic and brand name drugs. All of the benefits provided within the MEC Heavy Plan are only subject to the copay. Your maximum out-of-pocket expenses for covered benefits during the plan year is only $2,500, and preventive care is covered at 100% with no copay at all. Because the new Minimum Essential Coverage Heavy Plan is focused on outpatient services and does not include inpatient services, your employer is also making available a hospital indemnity plan to provide a fixed level of payment for inpatient and surgical services. Your third option is the Minimum Value Plan. This program has a $6,500 deductible for an individual and a $13,200 family deductible. This means that before you receive any emergency room, hospital, X-rays, or lab services, and even prescription drug benefits, you must first pay $6,500 in out-of-pocket expenses. This is in addition to your monthly premium payments that are up to 9.56% of your gross annualized wages. Doctor visits are subject to a $50 copay for primary care visits and $70 for specialist visits. After the doctor visit copays, the plan pays 60% of the incurred health costs. You would be responsible for the remaining 40%. And certain items, such as some prescription drugs, mental health and substance abuse treatment, physical and speech therapy, and outpatient treatment, are not covered at all. Network access is also an important element to consider when making your choice of medical plans. You may have had experiences in the past with networks on other medical plans. Most plans contract with a wide range of doctors, as well as specialists, hospitals, labs, radiology facilities, and pharmacies. These are the providers in a network. Each of these providers has agreed to accept a plan's contracted rate as payment in full for services. For example, an insurer's contracted rate for a primary care visit might be $120. If you have a $20 copay for primary care visits, you will pay $20 when you see a doctor in your network. Your insurer will pick up the remaining $100. If you go out of network, you'll almost always pay more, but at least you'll have a choice. Minimum Essential Coverage and Minimum Essential Coverage Heavy plans both include in-network and out-of-network benefits. The minimum value plan only provides benefits in-network, except for emergency room services, which are covered out-of-network. It's important for you to decide which program provides the most effective level of coverage and which is most affordable for you and your family. First, there's Minimum Essential Coverage, which is a wellness and preventative services plan. It is the least expensive plan, and there are no deductibles, no copays, and zero out-of-pocket expenses. Next, there's Minimum Essential Coverage Heavy, which focuses on outpatient services. It also has no deductibles and a $2,500 maximum out-of-pocket. Finally, there's the Minimum Value Plan, which includes surgical and inpatient services, but has a $6,500 deductible and requires 60% co-payments. After you sign up, your ID cards and benefit booklet will be sent to you with detailed instructions on how to get the most from your plan and find in-network doctors. It is very important to review your benefit booklet to understand exactly what is and what is not included in your plans. There is a limited enrollment period during which you can sign up for employer-sponsored health plans. So act now to get the coverage you need and to avoid IRS taxes and penalties. For more information, talk with your benefits department.